When it comes to hearing and information about hearing loss, my go-to person is with me now, and that is Dr. Abigail Sweeney of Louisville Family Audiology.
Hello.
Welcome back, Dr. Sweeney.
Thank you, John. It's so great to be here.
I love your passion. When you talk about hearing loss and the importance of hearing health, you're very passionate about this, aren't you, Doctor?
I am very passionate about it, yes. I'm very passionate about it. I live, eat, breathe, and sleep it. So it's something that the good Lord gave me a passion for helping others who have hearing loss, and hearing loss is just another form of long suffering. And so I can really empathize with our patients, and we try to give our patients a lot of education, but also a lot of compassion.
You've educated me, so let's get right to it then.
Yeah.
Okay, today we're going to talk about aural rehab. So what is aural rehab exactly? Because when I think oral rehab, I'm thinking, okay, oral, mouth. No, it's aural, right? A-U-R-A-L.
Aural, so like the auditory system. Aural rehab is just another way to say, how can we help a patient limit the impacts that their hearing loss have on their life? Hearing instruments are one avenue to give our patients aural rehab, but there are so many other ways that we need to be helping our patients. And so, so it's just kind of this broad overview of how can we help the patient limit the impacts hearing loss has on their daily life.
You believe in holistically treating hearing loss.
Yes.
So why is that so important?
It's so important because there are things beyond the ear that we need to be helping our patients with in order to really maximize what the hearing device can do. And so a lot of times we have this kind of this mono approach to hearing loss, and that's with a hearing aid. But you're going to falter if that's the only thing that you're looking at in terms of your hearing loss.
And you're very excited about bringing Louisville Family Audiology, this aural.
Yes,
right?
I am so excited. I am very excited. Our audiologists are very compassionate, and we've done a good job of educating patients, but not had a really nice formal, structured way to deliver the message to make sure that every patient is getting the same exact information. And so at Louisville Family Audiology, we have partnered with a company called the 5 Keys to Communication, and I'm super excited. There's a great audiologist out in Colorado. Her name is Dusty Jensen, and she actually has a really wonderful story herself about how she's an audiologist, and one of the things that drove her into audiology was actually her mom has hearing loss. And so she was practicing all of these really good aural rehab techniques already in her home or with her mother, and thought, why don't I create a program that other audiologists can do to help really drive this message home? And so she's developed a program, and we are going to be launching that hopefully in 2023 is when we'll do kind of the big launch to provide our patients resources beyond the ear. So
what will aural rehab teach a patient? What will it teach them?
Yeah, so Dusty's program, the 5 Keys to Communication, she teaches, or we're going to teach, the 5 different keys to communication, which are the speaker, the listener, the devices, the environment, and practice. So only 20%, and I kind of talked about this last time I was here, but it's a great message to drive home again. Only 20% of the patient's success is relying on the actual hearing device. But there are so many other factors that we need to educate the patient about besides just wear your hearing aids. So one of the keys is the listener, right? So the listener being able to really own their hearing loss and understand that this is a disability. This is one of the examples I give to patients, because so many patients think once I get my hearing aids, I'm going to be able to hear perfectly, and that is absolutely not the case. The success of you wearing hearing instruments alone giving you that satisfaction are very limited based upon what kind of hearing loss do you have? How long have you had the hearing loss? How clearly can you hear speech without the hearing instruments? There's all these different factors. So if somebody isn't owning their hearing loss and realizing this is a disability, but just because you have a disability, it doesn't mean you are limited in terms of the fact that if you own it and you say, you know what, I've got a disability and I'm going to make sure that I'm hearing the best I can in all situations. So the example I give is, if you were going up to a door and somebody was right next to you and they were in a wheelchair, what would you do? What would you do, John?
I would help them get the door open.
You would open the door, right? Well, you can physically see they are in a wheelchair, so you can physically see their disability. What happens with hearing instruments so often is patients wear the hearing aids and they think, oh, I'm going to hear perfectly. And then the spouse sees their loved one or whomever wearing the hearing instrument, And if the person can't hear, what's the first question they say? Well, aren't you wearing your hearing aids? Well, yes, but there are so many things that can impact the ability for that patient to hear clearly, even with hearing instruments on. So I tell people, you have to make your hearing loss physically known, just like that wheelchair is, and say, I am doing the best that I can, and sometimes I'm still not going to hear you clearly. Can you please speak up, or can you please slow down? But not being embarrassed to ask for those modifications, because so many people say, I've stopped asking because people are always going, aren't you wearing your hearing aids? Another thing is, if somebody is talking from a distance, this is going to be the speaker. So we're talking about the listener, now we're on to the speaker. If somebody is talking from a distance, they have a mask on, they have their back turned towards you, don't be surprised if you have to ask them to repeat themselves. You know what I mean?
Right.
But it's also important for the speaker to know when somebody has a hearing loss, there are so many things you can do to help them succeed. But don't talk to them from another room and expect that they're going to hear you. You know, don't talk really fast, because when you talk fast, somebody who has hearing loss, it takes them a little bit longer to process the signal, just because their brain has to sometimes fill in those blanks. So if you can enunciate your words clearly, and talk a little bit slower. So instead of talking like this and going really fast, you could say, instead of talking like this and going really fast, you just slow down the rate of speech a little bit. So that's something the speaker can do. Then we talk about environment. Don't go to Texas Roadhouse at 7 o'clock, maybe go at 5 o'clock, because it's not going to be as noisy.
Gotcha.
You know, so it's these kind of factors that we're going to be teaching and educating the patients about, but then also practice. So there are different listening activities patients can do to also increase their success.
So last question for you. So what will this program look like? You said it'll be available in 2023. What will it look like?
Well, the great news is we're going to be implementing it. The moment you say, yes, I want help, and the moment you say, yes, I want hearing instruments, that's when your oral rehab starts. So we're going to be giving our patients take-home materials. We also have an awesome online platform the patients will have access to be able to practice at home and do these different strategies. And then the other thing I'm super excited about is we're going to be hosting classes. And the classes are geared for not only the patient, but for their loved ones, because we want to get the message to the loved ones just as equally as we want to get to the patient, so the loved ones can stop putting all this pressure on their hearing impaired, you know, loved one, and they can also help just really empower the patients by utilizing these strategies as well.
All right. If you love this kind of education, this kind of passion, this kind of information, and you have a loved one who suffers from hearing loss, this is your answer right here.
Yes.
Louisville Family Audiology. She is Dr. Abigail Sweeney. There's the information on your screen. Give them a call. Congrats to you, man. You continue to be progressive and move forward.
I'm so excited. This is something that, like, my heart is just beaming with pride and joy and gratitude for the information and be able to share it with the patients.
All righty. We've got a topic we're going to talk about next. It's a sensitive topic, but attorney Ted Thomas is with us, and he'll tell you all about it. So that's